Hi, my name is Ramandeep Kaur and I am joined by Prabjot Kaur, Parjeet Kaur, Sukhman Kaur, Amandeep Kaur and Priyanka, and we are going to represent a topic community assessment of older adults in Canada. Our objectives are providing an overview of the community group that we have selected, reasons for assessing old people needs, techniques for gathering information, and why we are using qualitative data analysis, along with strength and limitations of the selected community, as well as services for the senior population. The last one is benefits of carrying out a community evaluation. The next is identification and definition of selected assessment community group. Our selected community group is 85 years and above in Canada. This age group is increasing rapidly in Canada. It is expected to triple to almost 2.5 million within the next 25 years. It is mainly due to expanded lifespans and slower population growth, means low reproduction rate, and they are suffering from age-related problems along with social isolation, loneliness, and violence, and they are also dependent on others due to their age. And next one are the assessment parameters, mean features which needs deep assessment. These selected parameters are health, caregiver support, social support, access to healthcare, financial stability, housing condition, safety and security, cultural sensitivity. And next slide will be represented by Prabjot Kaur.
Thank you, Raman, for introducing me. And my slide is about why the needs of older adults should be assessed. Aging is the natural process of becoming older and experiencing physical and cognitive changes over time, and the needs of older adults should be assessed because they are always at risk of different kind of diseases like depression, hypertension, and heart failure, etc. Because they have a weakened immune system, and the level of infection are more exposure in them, and they also have a feeling of loneliness at this age, and they are retired from their work. They don't have any busy schedule, and they also cut off from social connections. So this is about assessment, in which we use a qualitative assessment method. That is about the information can be gathered directly from people by observing their small actions, experiences, and feelings, and we use a observation, interview, and interpretation of uh, records for collecting information from people by making a community or large group meetings, or take an interview individually or by group. So this is helpful for us to collect data from people. So next slide will explain by Prajit.
Thank you, Prabjot. So, what are the reasons that we choose qualitative assessment? First of all, it helps in deeper understanding of every parameter such as psychological, social, and emotional well-being about their experiences and their perspectives. Next is it explores the complex and subjective issues and examine every aspect of life like their quality of life, aging, and health. Also helps in development of interventions and policies to get the better outcome. This approach is very more flexible and responsive, helps in gathering the data which is very scientific and relevant, and also analyze the data very quickly, even the sample is very large. Next is resources for qualitative assessment. First is senior scientists. They have trained staff members often provide services and programs to the community such as health assessments, educational programs, and social activities. Next is healthcare clinics also provide comprehensive assessment including health education, chronic disease management. Social service agencies also provide a range of services. Online resources are very reliable sources like such as American Resource Services website from where we can get information. Healthcare providers also often assess the health needs and risk factors of the community, such as physical, mental, and social factors. So, these are the sources from where we can get information about the people.
Hi, I am Sukhman Kaur and I will discuss the strengths and limitations of old age community. One of the main strengths is stability and security, as they often have stable incomes which can provide a sense of security. Secondly, they have a deep understanding of their culture and history, which can be passed on to younger generations. Then comes the life experiences. They have experience which can be valuable in the community. However, there can be some limitations of this community. They may face physical limitations and cognitive decline as a part of aging process. They may experience social isolation, which can lead to loneliness and depression. Moreover, they may be at increased risk of abuse, including financial exploitation and neglect. There are various organizations and services involved in this community. Personal care services help elders by assisting them with personal hygiene, dining, and taking medications. Therapy and rehab services are provided to clients who require chronic palliative or rehab support. Short and long term nursing care services may include care from the assessment of health status to end of life care. Financial support helps providing them with the monetary assistance they need to live. The Ontario Caregiver organization helps caregivers by providing a one-stop resource to seek support and services. Family managed home care is a home care program through which eligible clients receive funds. The topic will be discussed by Amandeep Kaur. Thank you.
Thank you, Sukhman. We will talk about the gatekeepers and stakeholders. Gatekeepers are the leaders and managers of nursing organizations and those who create and implement health policy. Stakeholders are those entities who are integrally involved in healthcare system and help the needy people, such as healthcare organizations, insurance companies, pharmaceutical companies, physicians, doctors, and many others. Now we will talk about the engagement of stakeholders in the community assessment process. First one is engage with community member, patient and stakeholder organization as soon as possible. Next one, identify the older groups, which is a key component of community assessment process. Next one, the data collection approach should strive to engage and give voice to community members and patients. Next, it is important to make the prioritization process or inclusive as soon as faster as sense of ownership. Next one, this would be done on the health system website through the variety of outlets, pamphlets. Next one, the improvement strategy developed to address the identified community health issues will put in the community health need assessment into action. And another one, implementing a community health improvement plan is ongoing process that is require the involvement and engagement of patient and stakeholder. Last one, it is important to plan for evaluation from the start. Thank you. Next slide will be shared by Priyanka.
Thanks, Amandeep. Now I'm going to discuss about the strengths and limitation of the qualitative research. This method allows the researcher to get detailed information about the respondent. And it is a more flexible method as the interviewer can ask any question around the subject matter. It can perform in the natural setting. There is no need to set any kind of the specific environment. And it is useful to test the theories and hypotheses. Next are the weaknesses. Data analysis is a time consuming and it is a very expensive method. Sometimes it may require the multiple attempts to assess and it's quite difficult to repeat the outcomes. Next are the ethical considerations. First is informed consent. That means person in the evaluation is fully informed about the evaluation being conducted. Participants must be aware of the purpose of project. Next, voluntary participation. That means participants are fully free to withdraw their participation at any time because it is the right of individual to leave a program. Next, do not harm. Harm can be physically as well as psychologically, so while assessing, do not cause any kind of harm to the patient. Next is the confidentiality and privacy. Confidentiality ensures such identification information is excluded from the published documents. Next is the relevancy. That means only assess those components that are relevant to the research. Next is the summary. In this we have discussed about the identification and definition of the selected community assessment group, assessment parameters, quality assessment approach and their resources, strengths and limitation of the selected age group. Next is the organization and services involved in the community such as short-term and long-term care. Then we discussed about the gatekeepers and stakeholders, strengths and limitation of qualitative assessment methods, and last, advocacy and ethical consideration in the community assessment. So these are the references. Thank you.